Stroke has always been a much feared medical emergency, and rightly so. Someone in the United States has a stroke every 40 seconds. And someone dies of a stroke every 4 minutes, amounting to 795,000 strokes and 137,000 deaths annually. Stroke is the third leading cause of death in the United States, behind heart disease and cancer. Not all strokes are preventable, so it is very important to recognize the early signs of stroke and get treatment as rapidly as possible. Stroke damages brain tissue, but that loss can be minimized by getting quickly to an emergency room that can connect to a rapid response stroke center. We all know that the brain requires blood flow to function, so, when a blood vessel is blocked in the brain or starts to bleed, you are at risk for severe and potentially permanent damage to the brain or death, if you don't act quickly. And, just like with many health problems, the symptoms of a stroke are often misunderstood and thought to be something else. You should be very careful, because strokes can cause serious brain damage, and, according to the latest statistics, it's the fifth leading cause of death in the US. Signs you had a stroke and might not know it. Headaches and migraines. You should be very careful, and if you're experiencing a bad case of migraine or headaches for a longer period of time, then you need to visit your doctor immediately. A sudden onset of fatigue. The experts also warn that an extreme fatigue for a long period of time can also be a sign of stroke, but it is often an overlooked symptom. The American Stroke Association recommends the following FAST acronym for recognizing the symptoms of stroke. The acronym stands for F. Face drooping on one side, A. Arm numbness or weakness in one side of the body. S. Speech difficulty. This means that when a stroke occurs, the lack of blood supply to the brain may cause slurred or garbled speech. You may think that you're speaking clearly, but if someone says that your speech is garbled, take the symptom very serious. T. Time is very important. Yes, you should call an ambulance immediately, as this step is often the thin line between life and death. Vision problems in one eye. This is very important for you to remember. Blurred vision or seeing double in one eye is often one of the most overlooked symptoms of a stroke. Confusion and difficulty thinking. And, one last thing, when a stroke occurs, the brain needs oxygen and blood, which leads to confusion and inability to speak or think properly.